Oftentimes, patients will come and describe the symptoms and not quite know what it is.
These are issues that they can address and get better.
I have patients that are in tears afterwards and saying, I actually feel like this is my new life. Urogynecology is basically the study of the pelvic floor and the function of the pelvic floor, such as urinary incontinence, bowel dysfunction, pelvic organ prolapse, issues that have to do with the pelvic floor and how to make sure that it's working well.
A lot of women really struggle with these disorders, and I think it's amazing how few people really seek treatment and they somehow make excuses or avoid things. We want to invite people to come in to feel like these are issues that they can talk about, that they can address and succeed and get better.
It is not okay to have these problems, and there are very good solutions that are non-invasive, easily accessible, and only very rarely will need surgical intervention. Prolapse is a herniation of the pelvic floor. It's when the vaginal walls become weak for a variety of reasons. When the prolapse starts, maybe a woman might feel some pressure. Maybe she feels a little bulge coming through the vaginal opening.
I've had a lot of patients say they notice it often when they're showering or when they're wiping to clean up. Sometimes women might describe it like a tampon coming out so that they feel something right there, but they can't really describe it very well.
Initially, it can be a scary experience because a patient all of a sudden notices that something is bulging, and oftentimes they are associating that with cancer.
I do agree with you about that fear factor because I have several people who they're really not that bothered. They just are afraid. They want to know, what is it? Yeah. And we can show them pictures and explain the anatomy and explain what they're experiencing and what it might be. And I think just doing that is hugely satisfactory for people.
Once you understand that it is actually a hernia, and it means that there's some weakening of the tissue, some weakening of the support, and that can be fixed with support, with exercise. And eventually, if that doesn't work, then we can also repair that with a surgical procedure that will be not very invasive. One thing that might help, and sometimes I discuss that with patients, they think that incontinence is a problem that only they're having. It's kind of unique, and that adds to some of their embarrassment. But when you share with them that actually throughout a woman's life, about 1 out of 3 is going to experience some problems with incontinence, all of a sudden that becomes a lot easier. It's almost like a relief. Okay, I'm not alone dealing with this.
The biggest hurdle really for most women is just getting in and just acknowledging that they are having an issue. Talk to your doctor about these issues. That's really as much a part of your health as diabetes and high blood pressure. And that's how we stay healthy, is to be active and fit and be able to enjoy those other activities.
I've had patients that have had 1 baby, 2 babies, and they've started having urinary incontinence, and for years, they don't do anything about it. They think that that's okay. So we're talking about a population that's not 80, but 35, 40, and that's where you can already start intervening and really improving their quality of life.
And I do find that patients often wait a little too long. They're a little bothered, they've noticed it, and then they really realize they've limited a lot of what they do because of these issues, and they don't want to be embarrassed. Yeah. And that's unfortunate. You don't need to wait till it's terrible and then feel like you've missed a big chunk of your life because you couldn't or didn't address the issues when you could have. Yeah. earlier.
Think of your life when you are one day leaking and then the next day you are not having any incontinence. I have patients that are in tears afterwards and saying, you know, I actually feel like this is my new life. I
Right.
can run around with my kids. I can play soccer. I can go and watch games. I can do all these things that I never thought I would be able to do again. And it's really an
Right.
emotional moment.